I have an important guest, and his name is Dr. Frank Serebour. He happens to be the current president of Ghana Medical Association. And those who don't know, Ghana is in the west coast of Africa, formerly called the Gold Coast. I don't know if it still qualifies to be called the Gold Coast, but
still go.
Yeah, and he's a great guest to have in the studio, attending a conference, and we're happy to lay hands on him to do justice to the topic today, because we're hearing a lot in the news about Africa these days. Most most of it is about the politics of Africa, but right now some people are doing the job of making people healthy. People live longer, live healthier. And this man happens to be a person who is spearheading some of the initiatives that helps Africans to live healthy, and especially Ghanaians to help healthier. And so I'm delighted to have him in the studio today to interview him and talk about the crisis in Africa, health crisis. Most people are not thinking about it, but it encompasses a lot of diseases, in particular chronic diseases like diabetes, kidney disease, chronic kidney disease, and a host of other things. Heart disease and everything else is going on there, and it happens to be very rampant these days. So, Dr. Frank Serebour, again, is the president of the Ghana Medical Association. He's playing a great leadership role in healthcare delivery in Ghana and West Africa, for that matter. He's actually a fellow of the West African College of Physicians and Surgeons. So his tentacles spread not just in Ghana, but beyond Ghana. And he happens to be a specialist pediatrician until he became the medical director of the Bekwai Municipal Hospital. He was working the hospital that most people know of, which is the Komfo Anoche Teaching Hospital, with thousands of beds, if I'm not mistaken. And so it is a privilege to have you in the studio. Doc, welcome to our studios in the USA.
Thank you very much, Dr. Oteng, for having me. I think we've been doing this once every year, I guess. I hope we can do that more often than we are doing. Hopefully, when I'm done with Ghana Medical Association, I'll be here more often so that we can have more conversations regarding our health, especially for those of us in Africa.
Definitely. And so we will go right into it. Again, we are talking about the crisis in health, African health crisis, diabetes, rampant, as well as kidney disease, and a host of other issues. But because our channel, we usually talk about cardiovascular diseases as it relates to complications to diabetes, we just want to stick a little there. But whatever he says actually goes beyond that. And I know the crisis is not just in that area. And so I'm going to be asking some questions and throwing in some points here and there too when I feel necessary. So, Doc, there's a lot of people who are worried about the health in Africa. Just how serious is the problem with long-term diseases or chronic diseases like diabetes and kidney disease in Ghana and Africa, for that matter?
Thank you very much. I think the landscape in Africa in terms of health is changing. And in the past, we had issues with infectious diseases, and that was what was the leading cause of death in Africa and, of course, in Ghana. Mm-hmm. But gradually, the non-communicable disease is taking over. They are basically on the ascendancy. So we are having a lot of people now suffer from these cardiovascular events. And definitely, we also have a lot of more of them having diabetes, of course, hypertension, and cancers. And so I think you are in the right, you are looking at these issues in the right perspective now when it comes to Africa, because a lot of these non-communicable diseases is what we are having to deal with recently. And in the past, when we talk about diabetes and hypertension, you are thinking of the aged and the old age and so forth. Now, the active age groups, including even children, are suffering from diabetes and hypertension and the other non-communicable diseases that you can think of. So it's quite an increasing burden. And clearly, when you look at Ghana, for example, when you take the national average, we have about almost 3% to 4% of our population, that's about 22 million population, actually been diagnosed with diabetes.
Wow.
And that is quite high. In some of the regions, it goes way beyond 15 to 20%. And that tells you that this is the national averages, because certain regions are recording lower averages, and that is what is even beating it down. And these are the ones that we have seen, the ones we've diagnosed. And so if you go to Western region, Ashanti region, Greater Accra region, we are leading the diabetes ranges. And so it tells you we are really, really in crisis. Hypertension is key here because, of course, diabetes seems to have a twin brother. And that is hypertension. They seem to work together because of course, the consequences of diabetes and what the impact it has relating to hypertension. And hypertension definitely has a huge effect on your kidneys, including diabetes itself. That's also leading to a lot of these chronic kidney diseases, which is on the ascendancy. And even for people who probably don't even have any idea whether they have chronic kidney disease, they may be harboring some deficiencies in the functions of their kidney, which gradually is damaging the kidneys until gradually one day somebody picks it up, and then you are told that you have a kidney disease that is too late to be able to deal with, because of course it was not diagnosed early. I'm sure I have entered into some of your questions that may come, but basically we are having a crisis with our issues when it comes to non-communicable diseases. Highly on the list is your diabetes and kidney diseases, and then the hypertensions and the cardiovascular events that come along with it.
Yeah, the sad thing is, though you see it there, it also happens to be rising here among people of African descent. So it's even living in the advanced countries is not making that much of a help here either. But it's interesting to know that it is taking over. Do you think that infectious diseases are going down, or it's just a matter of both of them going up?
I think we are having some successes with infectious diseases because, of course, lifestyles are changing. There are more conscious effort to lead some kind of a hygienic lifestyle. And so basically infections are on the decline. And but it doesn't mean we are out of the woods. We still, if you go to Africa, we still have a high burden of infectious diseases. And of course, now even we have diseases that emerging. Currently, as we speak, Ghana is dealing with issues of mpox. We've had a few cases of mpox that we have to be alerting everybody that we need to deal with it. And recently all of us have to deal with COVID and the issues of Ebola here and there. So Africa still has this issues with infectious disease. Malaria has not left us. We still have malaria with us, causing all kinds of problems. And so, yes, we do. But I think there were times that you could hardly pick even somebody with hypertension, let alone even diabetes. But now we have them in abundance.
I see. So do you think, I don't know how much your relationship with the other African countries are in terms of your organization and maybe even your own personal relations, but do you think this is a trend in other even West African countries, in other African countries, or is it just a phenomenon in Ghana?
Well, they say Ghana is a gateway to Africa. So wherever you find Ghana, you find everywhere in Africa. And so the situation is not too different from our friends across the continent. So Nigeria and other places, similar episodes of non-communicable disease, diabetes and hypertension affecting all of us. So I think it's very the same. And Ghana Medical Association is part of a wider group. We are part of the African Medical Association. So we do collaborate on some areas, including issues that affect all of us generally. Most of us are even part of the Commonwealth Medical Association as well. And then we move on into the World Medical Association, where all of us are member associations of the World Medical Association. And so we do partner in all of these areas, and we have common interests, because we know that whatever affects one country basically affects all of us within the enclave. So we do collaborate. And so these things that we are talking about is not exclusive to Ghana.
Okay. All right. So now, besides what people choose to eat, as it relates to diabetes, blood pressure, and stuff like that, besides what people choose to eat or how much they exercise, what other big problems in our communities, communities or even in a country like Ghana run? I'm not seeing my thing right. What other big problems do you think make these long-term diseases or chronic diseases worse or even common?
Well, I think that Ghana is not free from all the issues that occur in the world. Stress is one key thing that affects virtually everybody, and the issue of economics cannot be taken out. Once the stress starts, it comes along with all manner of things, and of course, hypertension will come in, diabetes, and stuff like that. They all follow. You can look at the issues of these herbal preparations that are also uncensored, because the damage that some of them cause is something that we know, because mostly some of them are not refined, and once they are not refined, there are chemicals in there that are likely able to damage all kinds of organs. And it's something that we believe that is also one of the reasons why we are suffering from some of these conditions, because I'm sure we talked about diet and exercise. Infections still plays a key role, because it's the viruses, and you are catching these viruses, and your immune system picks up some of these viruses in their attempt to destroy them. You develop some of these antibodies that ultimately go to affect your pancreas in a way and damages the pancreas. And so the viruses are also doing a lot of damage to us in this regard. Now, these unregulated issues of mining with all forms of chemicals that are being poured into our water bodies and our food chain. And of course, with these chemicals being bio-non-degradable, we are not able to break them down, and this effect. And I'm sure you are aware that even gold in itself can do a lot of damage to your system if you're exposed to it.
So
heavy metals. So some of these things are some of the reasons why I believe we are getting all that we are getting. And of course, some of these diseases, the most important thing for you is early detection. So are you able to screen? Do you have the health facilities that are able to screen for diabetes on a regular basis? Are the people willing to go and do the simple things of checking their blood glucose levels, and even just setting up to be able to allow their blood pressures to be taken? And certainly, do we even do simple renal function tests to check to see whether our kidneys are functioning? Even the way we pee, I'm sure most people don't even have an idea of how much volume of pee they should be doing in a day. So whatever comes, it comes. Whatever doesn't come, doesn't come. And they walk around because they are fine, they are healthy. So health facilities are available for us to be able to pick some of these conditions in the early stages so that we can quickly deal with them. And it's also a problem. And of course, you need logistics. So if you don't have logistics, you don't have the blood glucose strips, you don't have your BP apparatuses or your SPIC manometers to be able to check the blood pressures. If you don't have laboratories that are equipped enough to be able to do simple renal function tests or check your kidneys and make sure the kidneys are functioning properly. And cost is also key, because if you can walk in and you say you want to check a renal function test, the cost alone is prohibitive. So the likelihood is that unless you are not well, you are not going to go in there. There are a few facilities that are trying very hard to allow walk-ins, what we call wellness clinics. In fact, Ghana Health Service encourages every facility to have a wellness clinic where people can walk in, check their blood glucose level, check their BPs, and do simple tests, so that if they are found to have any abnormalities, they are referred to the major facilities to go and do that. But even that education is very, very important, and people are not taking advantage of it. And so you can see the reason why our burden is rising.
Yeah.
It's clearly because there are so many multi factors that come into it, and the personnel to even do this simple test is also something that is lacking in some areas. And so the spectrum of health facilities availability to all of us is not the same. I don't know how yours looks like in the United States, but in Ghana and of course in other African countries across the globe, depending on where you live, you are not likely to be able to have full access to healthcare like you would. And even in Ghana, remember that we do have a section of Ghanaians who are currently battling some form of a tribal war, as is happening in Boko and other places. Certainly, healthcare is also suffering. So these are some of the things that is actually encouraging our diabetes and hypertension and chronic kidney diseases. And usually when we pick them too late. And so we are unable to do much about it. And of course, even the renal transplants are not available to us. A few of them have been carried out in
But
the country.
I heard there's a lot of
So
these hemodialysis centers
but
coming
you
up.
see, dialysis is
But
only
it's too late.
a tool that is going to drain you and drain you and drain you and drain the resources of the country until we can't fund it anymore. And then that is done. So now I think that the current government is also trying very hard to continue with what the past government did by putting dialysis onto our health insurance. And there is even now another healthcare that has been launched. There's a Mahama Care to try and take care of some of these chronic diseases, but so that the burden of economic burden that is on families is taken off. But certainly, by the time you get to the dialysis stage, the both of us know that your quality of life is definitely not the best, and you need to travel sometimes from wherever you are, go and have this dialysis probably twice in a week, or if you are lucky, once a week, just to go and have dialysis done, come back. And the economic burden, even if you are not paying, is still not easy. And your ability to even work. Look at what your kidney will do to you in terms of your blood pressures, in terms of your HBs and so forth, and your ability to work. You can't work and work effectively and be economically viable. So it's actually too late when you get to that stage.
So that is actually the fact that the need for dialysis centers are popping up. I mean, coming and they are popping up means that there's a lot of damage already.
Precisely.
There.
Precisely.
So we don't want to go into that. We would rather not have dialysis centers
at all, and then so that we should be able to pick them early.
Exactly.
Deal with it quickly, and then so that people can recover. And interestingly, even for people who know that their blood pressures are up, they are hypertensive, it will shock you to know that less than half of them are on medication. Wow. Because people don't want to be on this long-term medications, and certainly some of our peddlers of herbal medications are also not helping us, and they take over the community information centers, and they are announcing to everybody that look, we have medicine that can get rid of your hypertension, get rid of your diabetes. You don't need to be on treatment for your lifetime, and that once you take this drug, you are fine. And once they preach that, who doesn't want a short-term solution instead of having to swallow pills every day? So they will definitely go to that area. And unfortunately, when they start that kind of treatment, they don't even go back to check their blood glucose levels. They don't go back to check their kidney function. And so they continue to consume these medications, which most of them become even toxic to the kidneys itself. And so what happens is that you are back into some kind of a vicious cycle. And ultimately, you would end up being on dialysis. And once you start dialysis, sustainability is also a very big problem.
Now, let's move to a different area of my points here. Now, we know that in the past, or maybe even currently still, we have rich countries, or big international groups that donate or give money to help support healthcare in Africa. How does this support, in Ghana and other areas help fight long-term or chronic diseases?
I think that this support has been with us for a long time. In fact, if I'm not exaggerating, I can tell you that some of these supports have been with us since independence. That's 1957. And there is support for our healthcare, there is support for education, there is support for governance, there is support for agriculture, and all kind of sectors that are very important for our survival as a country. And some of the supports, for example, USAID, escalated somewhere in the 1980s. So they've been with us for a long time. 1980, they were there with us during independence. They escalated to somewhere in the 80s, and they've been very, very supportive. And so, in terms of even infectious diseases like malaria and hypertension, and of course, in fact, TB and HIV, tremendous help, health infrastructure, research. So it's been something that we've relied heavily on. And so if we see this kind of donors being withdrawn, we wouldn't say that it's not within their right to withdraw, but I believe that it's something that should have been done in a phase-like manner so that they allow us to wean off gradually, because certain areas are very critical, especially with TB and HIV. And so if we wean off abruptly, it becomes a big challenge because we are used to it. I think sometimes we have also not managed ourselves properly, relied too heavily on donor support for some of these things. I believe we manage ourselves very well. We could have. And interestingly, Kwame Nkrumah, who indicated that we should, the independence of Ghana, said it's meaningless unless it's linked up with the total liberation of Africa. See, even that we are still not liberated because we still relied on the donor support. And you realize we say we are independent, but we are not totally independent economically. We are not independent.
Still depend on other economies.
We still depend on economics. Kufuor indicated that we are going to get to a point where we don't have to rely on donor support anymore, but we couldn't do it. So it tells you how important this donor support is to our health systems. So once that is gone, then what I would say is very simple. We all can see the ship wreck where it is headed. Mm-hmm. And the bottom line is that it's not heading to any good area. A lot of people are going to suffer. But I dare say that you are in the United States. You people are not immune to the problems that will come. Remember when we get our TBs, we get our HIVs, and we are not able to control them. Now the world has become a global village. Mm-hmm. So we will definitely come here. We'll cough on you. We would come around. We'll spread the disease. So it's important that we look at it holistically. Do targeted withdrawal. In fact, there are some of the areas that I think the monies are being misused or abused and so forth. So if we look at targeted areas that we can be able to support, even support the countries to be able to produce their own vaccines, so that once they are able to produce their vaccines, you withdraw, so that the countries now take over and are able to produce their own vaccines. Because as at now, Ghana and indeed almost all African countries still rely on foreign support for them to be provide them with vaccines. And so it's going to be difficult. I think we may be able to manage it. We may pull through. Of course, in crisis, there is always innovation.
Right.
So we are hoping that this crisis will bring innovation, would also bring us the ability to be able to manage ourselves properly. But I would have been very happy if it had been done in a phase-like manner, gradual process, and some kind of a timetable is drawn. And then all of us work towards it so that gradually we can win off some of these supports. But
what you said, do you anticipate that there's going to be rebound HIV spread and other things because the funds have all been pulled out? Or do you, you are in the GMA president, does the government or has the government informed you about plans to take over some of these things that has been pulled, some of these sources of funds that have been pulled, especially in the area of even HIV, AIDS, and those other infectious diseases that can easily spread? Are you aware of any plans
I
to
know
take
I know the government is seriously looking at it. I've been in some few meetings that discussions have gone on as to how best to be able to handle some of these treatments of HIV, TB, and others now that the donors are pulling off. But certainly, we don't have the full solutions. So we're still hoping and praying that because now we still have stocks probably available that we are consuming, but once these stocks begin to run out, that is when the true situation will come to bear. And so it's something that scares me. It's not only the drugs. I mean, the support even goes beyond just the drugs. Some thought the support goes to people who are living with HIV, giving certain support to be able to become economically viable. You know, once people become economically viable, they get something doing. The tendency that they will even break down is lower. They are able to commit to take their drugs, and two, the spread of the disease also goes down. If you push people, survival becomes another way that people would want to survive. I mean, every human being wants to survive, and in so doing, sometimes recklessness comes in, and that will lead to the spread of the virus. And of course, by that time, the virus suppression may not be there because people will not be on drugs. And once the viruses are not suppressed, the spread is also very easy. And so it's something that we are hoping that it doesn't happen, but I'm sure government is seriously looking at it. But it's a dire situation. It's not something that we are happy about.
That's a grim reality you are sharing right now. I mean, granted, you still have some stockpile of medications, but when you ran out, that's where the real challenge is going to show up, and that is a scary thought. To think that if people who are ready to take medications cannot get it because the government cannot provide the funds, and these drugs are very expensive. So hopefully, you come up with plans, not just you, but maybe the government in a connection with maybe the non-government agencies, find a way.
Yeah, I think local manufacturing of some of these drugs will be very helpful. There are a lot of pharmaceutical companies in Ghana that are well endowed and have the capacity and ability to manufacture some of these drugs. So I'm sure that is where government is looking at to partner with them so that we can produce the drugs in country and make sure that it's affordable and government can afford it so that they can be able to push these drugs to people. Now the health insurance, such as cut, has been decapped. So there is freeing some funds who are available to do some of these things. So hopefully we should be fine. But of course, nobody wants this kind of crisis. We don't have to go through a crisis before we become viable. So we would have wished that it was a smooth transition so that we don't even see it. But I am hoping that we don't have problems once. And we have experienced it before. You remember not too long ago, Gavi indicated that we're not going to give us vaccines for our children. And we ran short of vaccines in Ghana. That was just about 2 years ago. And we had to struggle to get vaccines because we rely heavily on donors for our vaccines for our children. And the problems that it caused, even to the point that there were some few cases of resurgence of polio.
Oh, wow.
And we needed to deal with it. So it's clear that we need the donor support to be able to. But on a lighter note, I'm sure you guys also are affected. There are some of your people who are also employed based on some of these donor funds, and they come in and they work it out with us and so forth. So it means all of them are also going to be unemployed. So
yeah, they are already unemployed.
So you also have the direct impact of it among your citizens. So that is why I'm saying that maybe a phased approach may have been helpful. And so we are not alone. I agree that sometimes some of the funds were being misused, and maybe streamlining it would have been far better for all of us.
Wow. I still can't. I don't know if we can go back to the days where there was no treatment for people. I remember some years ago, people would come from the Ivory Coast with HIV, just come and die because there was no treatment. So I hope that certain things are. Do you think the other African countries, because Ghana may be able to weather the storm, like you say, we have some manufacturing companies that, pharmaceutical companies that could potentially produce drugs there. But you think of places like Tanzania, the Eastern Africa, South Africa, places where HIV also did a lot of harm. Do you think they are all ready for the donor being removed and taken over to, treat their citizens? Because otherwise, again, the spread is going to be like
I,
wild.
I probably think that they are even more better placed than those of us who are more or less relaxed because they have seen the devastation effects of the disease. And I'll be very surprised if they don't already have plans in place to deal with it in case some of these donor support goes south. Because if you look at these South African countries and East African countries, the burden of HIV was quite high.
Very hard, yes.
So I don't know, but I sincerely believe they probably have plan B that they may be able to deal with their issues because they cannot have a plan to deal with this. Otherwise, it will be disaster. If people get off medication and they are not getting viral suppression and so forth, then I don't know what will happen. That will be too much to handle. So I believe that they may have plan B. They may have plans of how to deal with their condom issues to be able to distribute their condoms, make it readily available and cheaper for their people, and definitely be able to provide them with the antiretroviral drugs and anti-TB drugs. They are two friends. They will virtually work together. So if you don't have those two drugs, disaster is always lies in wait. So I'm sure they may have plan B to deal with these issues as well.
I hope they do. Now, with the GMA, Ghana Medical Association, what are the main ways your group is actually working to fight the spread of, main diseases of focus like diabetes and kidney disease, and potentially even these communicable diseases, which are also, unfortunately going to spread if funding gets pulled like we are thinking.
So for GMA, the good thing about GMA is that GMA is diverse. We have all kinds of societies under the ambit of GMA, and there are doctors who are into diabetes care that are forming diabetes groups, dealing with children with diabetes, dealing with adults with diabetes. We do have several individuals that are also supporting this arena of chronic kidney diseases. And Dr. Tano, for example, he is in Kofanochi doing fantastic work, so a member of the GMA. And so we are doing so much. Our members are together with other health workers. So much is being done. As we speak, I think this month is hypertension month, so we are encouraging everybody to screen for hypertension. People are being screened for free. You go there, your blood pressure is checked. We are even following them up in the markets to go and check their blood pressures and to be able to measure and make sure that they are not hypertensive. And if you are even close to being hypertensive, we need to enroll you into a facility so that we can monitor your progress and so forth. So much is being done. We do have the issue of, I think I informed you about the wellness clinics that Ghana Health Service, for example, is running, where you can walk in, check your blood pressure, check your BP. All you need to do is just carry your national health insurance with you. You don't pay a dime. You just go in there, check your BP, check your sugars, and then if you are free, you are free. And then you are scheduled again to come another time. There, we were trying to incorporate something we call a paternal weighing into the weighing system, so that if you are a father and you accompany your child to the routine ANC care or post-natal care, what happens is that your BP is checked, your weight is checked.
Oh, wow, that would have been great.
Those things were something that we're trying to do together with Ghana Health Service in the past. So all of these things are things that, and of course, education is also very important that we've been doing. And as part of our own self, there is what we call the staff screening exercises that happen once every year for those of us who work in the hospitals. So as part of the screening, you are screened for diabetes, you are screened for hypertension, your BMI is checked so that your weight and height are measured, and then your BMI is checked. If you are overweight, you are informed underweight, or you are obese, or you are close to becoming obese like myself. you are also checked, and then you are given dietary advice, and you are educated on what to do and what not to do. And once you are healthy, that is the only way you can provide good health for others. And that is also for us to be able to, because most often than not, the corporates who don't like checking their blood pressures, who don't like checking their blood sugars are the health workers, because the machines are with us every day, but unfortunately we don't even check our BPs, we don't check our sugar levels, and we only come in when we are already gone. But we still do have cases that come in either in coma, and only for you to check the sugars and realize that the sugars are unrecordable, too high to be recorded. And then there are times that people come in, and the first time you are seeing them, they are coming with cardiovascular events. They already have their strokes, and there is nothing you can do. You check their BPs are over 200 systolic and above, and sometimes even up to 150 diastolic and so forth. So it's crazy. But we are doing a lot, and the education is ongoing. But of course, we do have our limitations. The numbers are not even there. So it's just a work that we do together with other health workers, the nurses, the laboratory workers, and then of course the pharmacists. And now there are a lot of pharmaceutical pharmacy shops that you can walk in and check your BP and check your sugars. Okay. So instead of you even going to the hospital, you can walk in there and get your BP checked. So because they are in the communities, they work with the people. If anybody has a headache, the first point of call in Ghana is, let me go and get some acetaminophen over the counter in a pharmaceutical store. Once you get there, your BP can be checked, your sugar can be checked, just to try and make sure that we are picking these cases early. So much is being done. We hope it yields the necessary and the needed results that we need to get, so that these issues of non-communicable diseases can be dealt with swiftly.
It's a very alarming situation if you look at the statistics. I don't know how people are going to survive, most of them, especially as you say, when we have no annual screenings done, just going about our lives anyhow, because we are all busy, right? But hopefully people will listen to the education that you are providing through your organization. Now, let's move on. What are the most important changes that leaders and health systems in Ghana, and of course over in Africa, need to make right now as you speak, to stop some of these people from getting these sicknesses?
So first and foremost, I think it's lifestyle changes. I mean, we need to, as quickly as possible, begin to retrace our roots.
But that's on us. Yes. But what about you, leaders?
As the leaders, for example, people want to work, but there are no avenues for them to be able to work. And that is the reason why I'm saying that lifestyle changes. It's important that even walkways in Ghana, we build roads without walkways. We build roads without ways for cycling. So people who want to even cycle, nobody gets the opportunity to cycle. So, and of course, the dangers for you walking on the road where there are no walkways is quite outrageous. So you wouldn't even want to dare that. You will die early before hypertension and diabetes kill you. So you wouldn't want to go there.
Right.
Even the parks that people used to go and sit and children go to play and adults can join them and walk around, we are selling them and putting up buildings. And so we need clear policy as to where we want to go. And if we are not able to do that, that is where our problems start. So I believe that we should have that kind of policy clearly outlined. Of course, we need to improve our health infrastructure. Once we do that, we will need people to work in there. And so how do we get people to work in there? I believe that government alone cannot employ all the people that they need to employ. So how best are we supporting the private sector to be able to take part of this burden of the government? What kind of tax incentives are there for those people who are willing to go into certain deprived areas, for example, and set up private practice so that they can support the endeavors of the government? What kind of economic policies are we putting in place to ensure that people are economically viable? Because poverty comes with a whole lot of things. And there are a lot of people who are still living below $1 a day. If I say $1, I'm sure that's how you understand it. Yeah. So if somebody has to spend less than $1 in a day, it tells you that it's difficult. I think, I don't know how many of you can survive on $1 a day.
That's almost impossible. Even your phone bill may not
good enough. So poverty is something that is also important. We need to deal with the economic issues, the bread and butter issues. Now, the issue of environmental degradation is on the up, and galamsey in Ghana is huge. destroying our environment, water bodies, our food chain poisoned, and so forth. Our aquatic life non-existent. If we don't deal with all of this,
that's from the illegal mining.
Yes, if we don't deal with all of this, there is no way we would be able to get any proper healthcare. Look, people talk about the fact that brain drain, people are leaving and so forth, but there are equally high number volumes of health personnel who are home, not being employed. So, what are we doing? So there is a lot that the government can do. We have to have deliberate policy on some of these non-communicable diseases like hypertension, diabetes, and so forth. 1 month in a year alone as a diabetes month is not enough, or hypertension month is not enough. So we have to make it a daily routine. It is something that should be done. Wherever you go, your blood pressure should be measured. There should be ability for you to measure blood pressure when you go to the bank. Because it's something we have a problem. We have to pick it early because the drugs are expensive. We are struggling. Which one is easier for you to pick the hypertension early and advise on lifestyle changes so that the person doesn't come on medication, rather than wait for the person to rather have his hypertension or have his diabetes and then now put on medication. And some of these medications, once you start, it's for life. Good. Now, even in schools, children are not encouraged to play. You know the interesting that happened in my boys' school. Usually when they close from school, there is an old site where they move to go and sit and wait. And now parents are complaining that when the children go there to sit and wait, they play a lot and some of them get injuries. And so now what they have decided to do is that when you come there, no avenues for you to play. Bring your storybook, come and sit there and read. This is a child who left home early in the morning, no exercise. He came in a car, he dropped in school, went to the classroom. He's been taught in the class. He closes from class. He comes and sits at the old place waiting. He has no avenue to go and play. He waits for the parent who drives in, pick him in the car, send him home. He's given a tablet or a laptop. He's playing with his tablet in the night till he falls asleep, wakes up the next day, and he's piling up calories. No room for exercise. And so which one we want? That children would rather go and play and have the few injuries that we all had when we were young. I mean, it didn't kill us. The falls, the cars, the bruises, and so forth. That means I'm stronger, even mentally. Rather say no play, pick your storybook, just come and sit here. And it's us. We have created the environment such that we think that we are making our children comfortable, but we are rather killing them. So those are some of the policies that we need to look at. Can we provide the parks? Are they available? Can we make sure that there are protected parks where children can play? And rather make sure that we strengthen our first aid in the schools so that if these cars and schools are okay, we are able to deal with it. And parents should be free in their minds that if you come and your child has a few cuts here and there, you take him home and then it's not something that you'll be so much screaming on top of your voice and everybody has to run helter-skelter. So we need to have policies. I mean, because for us, our danger. Look, how many people can afford a treadmill? How many people can afford a treadmill in their homes? So where are the areas for people to be able to even exercise? How many people can afford to pay gym fees? And even going to the gym in itself is a lot of time
sacrifice
that you will need. If you don't have time, and you can probably just walk. I have been here seeing the walkways that people within the communities, people are able to walk, people can walk and whatever. And of course, our diets is also changing. So because now we also fast, everything is fast food, fast.
You get those in Ghana, Africa too.
Yes. So, and we basically have adopted your lifestyles that we are also eating a lot of these non-organic foods. And so what is happening is that, and I'm sure you are aware that for us, even as Africans and blacks, our genetics is such that we are already predisposed to hypertension and diabetes as compared to Caucasians.
Right.
And so if we create the avenue for us to rather suffer more, we will suffer more. And our healthcare systems are not as strong as what is here.
Right.
Because I come in here and I see everybody says, I have an appointment, I have a dental appointment, I have an eye appointment, I have how many people in Ghana have any dental appointment or have any appointment anywhere? They don't have any appointment. They just walk around till they fall. And once you fall, you are carried to the hospital. And then you are given a review date. If you are lucky, after 2-3 reviews, your doctor says, no, I don't need to see you again. That is it. So we do have a lot to do, and I believe that the politicians and so forth, they need to strengthen our health systems. Look, it's not for nothing that anytime any of them get sick, they get scared and they run away and come to.
So are you trying to say that the insurance system, because as you say, Ghana has national insurance, is it a barrier to people? Because if you have national insurance, we don't have national insurance. Of course, if your income is not great, you may qualify for Medicaid here and there. But you have national health insurance. I don't know how expensive it is.
Well, see, our national health insurance is very good. It's helping a lot, and I will not sit anywhere to say that national health insurance is not a very good thing. So, but our national health insurance is more of a social kind of national health insurance. It doesn't take care of the high ends. And that is the reason why we were talking about dialysis and the fact that national health insurance wasn't taking care of dialysis. So if you go on dialysis, it's in your pockets. It's always on you. There are still certain conditions that are not on the national health insurance. And even for the national health insurance, your range of medications that you can get is also limited. There are certain medications that nobody will put you on if you are not willing to pay. And sometimes those things will become an issue. So national health insurance, fantastic, but there has its own limitations, and it will not deal with the issues of non-availability of, should I say, laboratory labs that are readily available to be able to check whether your kidneys are functioning properly or not, unless you walk into a hospital. If you don't go into a hospital, it means that your national health insurance means nothing. And there are even people still who are not on the national health insurance as well. And so for me, I think that there is a lot more that we can do. National health insurance has actually improved access. It has done a lot in terms of improving access, and because without it, the cash and carry was something else. It was tough. So let's strengthen it and let's make sure that it works and works properly for all of us.
Now, just as I know, last week show we talked about screenings on regular routine screenings that have to be done. Is the standard of practice in Ghana and Africa now towards where you tell patients,
I listened to you and you were talking of colonoscopy
yes,
and all those things. In Ghana, who does routine colonoscopy? It's not part of our routine.
It's not routine.
No, it's not. It's not. So if you want to do it, that means that it's you, the individual, that you have to take a decision that you want to go and check your prostate and see whether your prostate is okay. You want to go and do your cervical screening to check whether you don't have cervical cancer or you even have precancerous lesions and so forth. Nobody is interested in your colon, so we don't go and do your colonoscopy. We don't put anything in your inner region to go and check whether.
Wow.
That is why I'm saying
the only time you get it is
when you yourself decide you want to go and do it, and that is at a fee, or when you have the problem. And so most of the cases that we see are cases that are already having symptoms and people are already developed their cancers, and then so you now go in and once you have the cancer, basically it's a death sentence. Or what are we going to do? You're just going to go through chemotherapy, radiotherapy, and then certainly all the therapies. But ultimately, what is the
because by the time you find it,
the prognosis is usually very poor. So we don't have that, and it's something that we have to work towards it. You see, bottom line is that if you are in a place where malaria is killing you, you are having TB killing you and so forth, you are not thinking of colon. You are not thinking of colon. Colon,
you don't see it.
It's not something you are thinking of. So it tells you where we are, but these are important. They are very, very important, because if the way we are getting younger people coming down with cancers and coming down with all these non-communicable diseases is something we should be looking at. It's something that National Health Insurance, for example, should pick up and say that every year, once it's your birthday, just as you are entitled to be able to check your sugars, BPs, and so forth, we'll do a total screening to check to see whether if you're a man, your prostate is in good health, your colon is fine, at least beyond 40 years going.
Yeah.
Those things can be checked. You check your
No,
breast.
but that is something
Check your breast.
being in the medical association can bring up as a policy for them to adopt.
Unfortunately, you can bring out a policy, but the policy comes with funds, and you know our budget is supported heavily by donors. I'm sure you're aware of that.
Oh, you mean the country?
Yeah, the country's budget is also supported by donors, so it means that we are not even able to fund our own budget. So it's a good thing that we are talking about, but I think that these are some of the ideas that probably. But look, sometimes you have to take all of this into perspective, because once you start screaming on top of your voice that we should be thinking of prostate health, colonoscopy, and people are dying from malaria and so forth, the next thing is that people will say these elite people, they are selfish. Look at what they are rather thinking of. They are thinking of themselves because they have gone to eat all their foods, that they are canned foods and so forth, and they are afraid of getting their cancers. Now they are not even talking about us. So it's quite difficult, but it's something that we need to get to. I'm sure we'll get to that point one day where we'll have systems in place that deals with these infectious diseases, and then of course concentrate on some of these non-communicable diseases. Now the attention is gradually grinding towards that direction, because we have been able to. I remember meeting both political parties before the elections, and I vehemently indicated that there is a need for them to introduce the vaccines for cervical human papillomavirus, so that our young girls can get vaccinated. And once we get them vaccinated, it's something that will prevent them from getting these cancers. And I actually made this point forcefully to the NDC. I made this point forcefully to the NPP then. And I am happy that it's something that the government is considering now, that they are going to include that in our vaccination drives, because we did a little bit of work in Bekwai, and we realized that the women we screened, almost about 15-20% of them had precancerous lesions.
Wow.
And some of them even had the human papillomavirus, in fact, within the bracket, and we needed to deal with it. And when you see that and you treat them, it's one and for all. But this is just a small catchment area. So this is what encouraged me quickly. I had to pick my girl, your daughter, from school and get her vaccinated, so that she's had I think 2 or so. She's had the first one, the second one. She's waiting for the last third one. But that was what brought the attention to the fact, hey, this is dangerous. We need to sort it out. But the vaccines are expensive. So if you leave it to individuals, people who are, as I indicated to you, are living on less than $1 a day, you expect the person to rather spend the money to go and prevent a disease that she or he doesn't know when it will strike, when she's not able to buy 1 square meal. But when it's free for all of them in school, when they go to school, they get it, and they get the vaccines before they are 13 years and so forth. It's wonderful. And it will save us a lot of trouble.
Yes.
Because that is where I believe, and this is an advocacy of the Ghana Medical Association that we discussed. We are hoping we can do something even more in relation to some of these screenings that we do.
Yeah, I mean, I don't remember the last time. I think I was probably in college when the HPV vaccine became something that was talked about, and people had to get it. For us, it's people who are resistant, parents who are resistant.
So you have the anti-vaccines and so forth. Well, of course, in the midst of plenty, even in Ghana, we do have some people who have issues with vaccines, and they think that they shouldn't be getting the vaccines and so forth. But for us, childhood is mandatory. Every child, whether you are somebody who buys into vaccines or not, it's mandatory that you are by law. That you get your children vaccinated. If you don't do that, you can be arrested. And so that one. So yes, we do. In fact, COVID came and people were resisting. People didn't want want to get vaccinated and so forth. And so, I mean, we still have them everywhere. So we are not alone in that bracket. So at least let's make it available to those who want to take the vaccines.
Right. All right. So now, with all these challenges, Doc, what gives you the most hope that things can get better for people's health in Ghana and Africa as a whole? Because you are painting a very grim picture. I mean, for people not to be getting screened, for cancers, just waiting for things to happen, it's a sad case. And especially if you add to the fact that USAID, a huge donor to health and other resources in Africa, has been withdrawn. It looks like a very bad future. What do you think?
Okay, so what gives you
gives you hope? Yeah.
So let me indicate that I am there. Myself, I've not run away. It means that there is hope. If there was no hope, maybe all of us would be gone.
Okay.
So the fact that we are all there, we are still soldiering on, we are still discussing the issues, we are still trying to better the health system in the country and other areas of Africa and so forth, means that there is hope. There is always hope. And once we are alive and we are kicking and things are changing. I mean, life in itself, how old is Ghana? Ghana is just less than 70 years old. And some nations are way into their so many hundreds of years.
I think the US is over 300 years old.
So it tells you that in terms of development, we are still a little bit behind, but it doesn't mean that we won't catch up. We will gradually get to where we have to get to. So there is always hope. And I believe that with all the things that we discussed, you realize that we are also offering solutions. We are offering things that we can do to make sure that these challenges are surmounted. So there is always hope. And I have very, very much hope that we will improve. In fact, we have improved. And I think last year when I came here, I told you that we have improved, because there were things that we didn't use to do that we are doing now. And how many dialysis machines did we even have in Ghana? We have a lot of them in the country that's taken care of us. We are improving our intensive care, ICU care. We are also improving.
You think the same thing is going on in the population? Areas like Nigeria?
Nigeria, definitely. I'm sure they are. We do have a very strong collaboration with Nigeria, so a lot of things are also improving there. Yes, we may have our own issues, and you see, the point is that we all wish it is better. We wish it is far better than we have now. The doctor-patient population is improving, even though we think it should be far better than we have now. Even though we are losing some of the doctors and nurses and other things to the diaspora, I believe that it is necessary. And I always say that we are not losing them. They are just going out there. They are bringing us even foreign investment and support back into the country. And so let us better use the resources that they bring back to us, so those of us who are there will benefit from it. And then let's see how best we can also encourage the private sector to complement what the governments are also doing. But I have so much hope that everything will be fine. It's not like
you think the hope is embedded in policy change, or just the reflection of knowledge?
Definitely with policy change and knowledge base. Now even in Ghana, a lot more doctors are going to subspecialties. The nurses are going in there. My own wife, she's now an emergency nurse specialist. In the past, you didn't have anybody doing specialization in nursing. Now we are having nurses who are also specializing. And you see, once you have the full complement of these subspecialties, people who doctors are subspecializing, supported by nurses and other paramedics that have also subspecialized, you can see that the care in those areas will certainly be better. And so it is something that is, and we now even have facilities in Ghana that are yet to even start operating. The Agenda 111 that the previous government started, some of them are ready. We are now going to populate them with workers so that they can start work. So infrastructure is something that is also being improved. So I see the improvement, even though it is slow. But I see it, and I see that the wheel is grinding. We wish it to grind faster than it is, but the policies are there, and there are clear signs that we will be fine.
Now, I have a question about, I know a lot of African diasporans are settling in Ghana. In the US, we know a lot of African Americans are coming down, Jamaicans, others from other places, Brazil, other places are going to settle in Ghana. Now, how did they deal with these health challenges? Do you think they come back for their screenings, or they just adapt whatever is there? Or do you have some elite institutions that are taking care of these people who are coming?
I think that there are elite institutions that take care of all these people. Once you have your money,
Okay.
you have your University of Ghana Medical Center that is there. You can pay, you can go there, have your screening, have your health checked out. Maritime Hospital in Tema, doing very fantastic. So there are elite private facilities that are available for all of them to be able to access. And I'm sure they are not settling in the remote areas of the country. Okay. They are settling in the urban areas. Most of them are in Accra, in the high-end areas of Accra, and some of them are living in the best environment in the Abri areas. Very, very serene, good temperatures and oxygen. And once they descend, they get into Accra and they get their healthcare. That is also fantastic healthcare that is provided for them. So yes, they are coming because they can afford. I mean, when you come in with your foreign currency, and you even some of them are even establishing businesses, and so their businesses are doing quite well. So because they brought in capital, and that capital is not available to rural folks who are in the country to be able to do same.
So basically, you are saying that if you have the money, you have the access.
Oh, definitely, you should be able to. And even when push comes to shove, you can always jump onto your the next available flights, and then you move out to go and get the best of healthcare. Yes. Meanwhile, that is not available to the ordinary Ghanaian. Yes.
So, who are the majority, right?
They are in the majority, definitely.
And we are happy you are there to serve those people.
We are trying our best to do what we can.
So what is the one most important message that you want everyone watching today to know?
So my key message for me is very simple. With all of this, you need to take your own healthcare into your own hands. Do the little that you can do. There is a story that I learned in my leadership training course, and that was the last story that was told, the story of the hummingbird. And the bird, apparently there was a bushfire, or the forest was on fire, and all the animals had run away. They're standing somewhere, the elephant, the lions, and so forth. And this small bird would fly, go into the river, dip its beak into the water, and comes back to the fire, and was doing this several times. And then the big animals asked, "What are you trying to do, you, this small bird?" The bird said, "I'm doing my part. So if everybody does his part, maybe this forest fire, we can quench it. But you are all standing and watching me, but I'm doing my part. So let's do our part. If you're a health worker, do your part. Do the best of that you can do with open hearts, with a good heart, good mind, the best of your ability, and go the extra mile. If you are ordinary citizen, take care of your health as well. Make sure that you also walk in, make sure your blood pressure is checked, your sugars are checked. If you can even do that once a year, just once a year, it will save you a lot of trouble. And even if you're on medications that you are told that can get rid of your diabetes or your hypertension or your kidney disease, go back and check to make sure that you are not getting worse and that you are indeed getting better. So let's take our own healthcare into our own hands. And once we are able to do that, and let's have an inquisitive mind. Let's ask questions. Let's ask every time. Let's ask. And then, of course, people should be listening to your program. And I sometimes I pop in there and I listen a few times and so forth. You are doing fantastic work. So I encourage people. My last way is that I'm encouraging people to also watch this program.
Join us.
Join you so that we can all learn about our health.
All right. Thank you so much. And I'm also a proud brother of yours. It's sad that your tenure
it's coming to an end. I'm really happy. It's been stressful.
I'm sad that your tenure is coming to an end. But like you said, wherever you are, your little will be done and will be felt.
Absolutely. I'm thrilled. I'm thrilled that it's coming to an end. It's been hectic. Very soon I will be launching my book, In the Dark Shadows of the GMA.
Oh, okay.
And the book is especially in production now. So very soon I'll be launching that book. That tells my life story through GMA over 20-something years of work in the Ghana Medical Association. In fact, not only the pleasant ones, but the ones that would shock people that have gone through all of that and still standing. So maybe when it's launched, I'll have to fly a copy.
Oh, definitely.
To you, and then you can share with your.
Definitely, and we'll do an interview on that
so
too.
That you can do that.
Yes.
So I'm happy it's actually coming to an end. Maybe somewhere in November, I would hand over. But when I hand over, per our constitution, I'm still supposed to hang in there as the immediate past president, be part of the executive committee and the council, so that my experiences will be tapped by the new crop of leadership that will take over, so that I'll still be at the background for another 2 or 4 years supporting. So, and even after that, I still remain a faithful servant of the association, and I'll always be available to support. So I'm not gone. I'm still there. I'm still there.
Great. That's good news. And again, we want to say thank you so much. This interview was impromptu. We're going to do a Memorial Day grill. I was going to call up the show today because I'm hosting my big bro. But the women changed the agenda. They are like, you guys go do interviews. So
you see,
we didn't go
they see how powerful they are.
You
see them, you think you are powerful. The women are far powerful than you. They change your destiny, your itinerary for the day.
I worked that, and that is also to you, because you would have said that I'm tired. I went to this conference.
Oh no, me and you, we can't be tired. We belong to the old stock. So it's good. It's great to have you, and I admire your tenacity and that you consistently do this. And sometimes I ask myself, hey, at this time, after all the work, he still comes sit here and he's doing his best to educate all of us. Jack, you are doing a fantastic job, and I hope God will strengthen you and make sure that within the next year when I come, your listenership and your viewership would grow, and because there's a lot of information that is being churned out every now and then from here. So kudos.
Thank you. Thank you also for your great work. 20 years in the Ghana Medical
Over
Association.
20 years.
Over 20 years.
It's not been easy at all.
It's a great work. And we're only talking about that, but you still practice.
Oh, yes, I still practice.
Receiving calls, still managing the municipal hospital.
I still practice.
And that is a huge
In fact, my practice is some of the things that keep me going. You know what? Let me say that anytime I walk into the hospital, the first thing I do is that I put my bag down. And the next thing is that I'm heading towards the ward. So I would go to the ward, and usually I have 2 wards, the newborn units. So that's my first point of call, the NICU. Make sure that I'm familiar with every single patient that is there, do my ward rounds with my junior doctors and my nurses. And once I'm done, I'll go to the pediatric ward to try and also do ward rounds there, check on cases. And of course, if there are serious cases that needs to be attended to, we do that. If they have problems, I try and resolve them before I come to the office to do office work. So it's a routine for me, because I keep saying that the office work is just for me, not my professional work per se.
Right.
So that is the reason why some of us, we are comfortable regardless of wherever we are. And I believe that this administrative work is maybe temporary. I may be in it till I go on retirement, or somebody may decide that still move back to your clinic. And so I should be comfortable with my nurses and my doctors every time. And then, of course, be able to offer the support that I need to offer to my patients. Currently, I'm still the only pediatrician in Bekwai. Wow. So whether I like it or not, I still have to see my cases. And so when I'm even here, I'm still getting calls. I'm getting, thanks to technology, videos are done and sent to me through WhatsApp, and I'm able to review them.
I've seen sometimes you do it.
So, yeah. Wow. So we are doing our bit.
Great
like
job.
The hummingbird.
That guy, the hummingbird. That's actually a very wise thing. I'm going to keep it in my coconut. No little thing is small, right?
Yeah.
Just keep going. Your impact will be felt at some point. So again, thank you, and sure. I'm pretty sure next year we will see you again.
Absolutely.
Yeah,
absolutely. So
viewers, we want to say thank you. If you liked the show, if you are watching later on, make sure you hit the thumbs up, share, and subscribe if you haven't subscribed. And let's grow our community of health education together. Until we see you again, I say, beloved, we wish above all things that you prosper and be in health, even as your soul prospers. Thanks for watching.
Amen.
All right. So, for those who are watching on YouTube, you can click on the next video right here, and then you will be able to watch another thing that is related.
Oh,
good. Right. Thank you, Doc.
Yeah, thank you. Your studio is getting more distant. Oh, yeah, anyway.